I'm joined by Melanie Boulerice, CEO of Nomadic Nurse Agency. Melanie, thank you so much for joining us today.
Thank you for having me.
So as you know, the government is planning to unveil a plan to help out the nurse shortage. Obviously, there is, at least 4,000 nurses missing in the, healthcare industry right now. Hospitals are severely overcrowded and are needing a lot of help. What is your reaction to that?
Well, to be quite fair, this is a cry for help that's not new to us. We have been asking for help on the healthcare sector for quite some time now. And however, this pandemic has simply catalyzed our needs to such a high level that we now are facing a complete healthcare crisis where we cannot continue our ways, and we cannot continue these ways of working. We cannot continue working with these resources and conditions. Tax-paying citizens deserve better. Healthcare professionals deserve to do their job properly, and they deserve to do their job with sanity. The job is so difficult and challenging now that it's very difficult to be teaching nursing students the future of healthcare, because it is now not what it used to be. And even though we've had several years of complex issues, it is significantly getting worse. And finally, after having 4,000 nurses burn out and counting or leave or do whatnot, this is where we are finding a solution. We should have found a solution a long time ago.
Mm. And speaking of, obviously you're on the ground right now and you're seeing what's happening in these hospitals. What are you noticing right now in the midst of the fourth wave?
We are seeing young COVID patients, not just young COVID patients who are going home, young COVID patients intubated and being sent to the ICU, needing treatment for quite some time. It is not what it was at the beginning of the pandemic. The beginning of the pandemic, yes, we did have some young candidates, but we had majority of elderly people. That role is quickly switching, and we need to be aware of that. This part of it is not a joke. This is getting more and more serious, and this is why what we were fearful of, because when a virus mutates, it can get more dangerous as well as it can get less dangerous. We need to be aware that right now we are seeing young clientele coming in requiring intubation who are generally healthy. And yes, we had this problem before, but it's more prominent now.
Yeah, absolutely. And when it comes to, this plan that is set to be unveiled, what would be your hopes for this plan? Of course, more staff would always be needed, but is there anything else that you would, you have noticed that would be extremely helpful?
Come to the emergency room, come to the critical care unit. Politicians who are making these decisions should see by hand what is going on. And I'm not just talking about Montreal, I'm talking about up north. I'm talking about in the more rural areas. They need to see what their healthcare system is doing and how it's treating people and how our healthcare professionals are burnt out. And 4,000 nurses is now, but the conversation of nurses leaving the profession or leaving bedside is higher than 4,000, significantly higher. So I would love to see politicians who are making these decisions make their way into our healthcare system, our tertiary healthcare system, the system that is designed to treat illness instead of prevent illness, to come in and take a look at what's going on.
So we'll see what this plan will entail, and let's hope that this will significantly help the healthcare system and all the staff that is working tirelessly. Thank you so much, Melanie, for joining us today.
Thank you so much for having me, Brittany.
Of course.